Welcome to Prepare to Care, the AARP podcast that provides resources and tools to support caregivers and their families. I am your host, Charlene Hunter James. Nearly 7 million Latinos in the U.S. provide unpaid care to an aging or older loved one. Many Latino family caregivers see caregiving responsibilities simply as something family members do for one another, and they do not seek outside help. Today, the face of the Latino caregiver is changing. Here to talk to us about the change and what it means is Dr. Jacqueline Angel. She is a professor of public affairs and sociology at the University of Texas at Austin. Dr. Angel, thank you for joining us.
Thank you for inviting me today.
Okay, you recently had an op-ed published in the Houston Chronicle in which you spoke about the Latino caregiver and the challenges they face. Tell me why did you feel the need to write that, and what is happening in terms of the Latino caregiver?
I wrote the piece because, first of all, it was during Hispanic Heritage Month. And it's always a nice reflection to recognize the strengths of the Hispanic population. But as you pointed out, there's many changes in our society that is highlighting and animating new challenges for the Latino population, particularly for Latino caregivers. I have done research over the last 30 years funded by the National Institute on Aging to look at these important health and care needs for the Latino population across the life course, but more importantly for older Hispanics and those who are trying to age in place. So this was an opportunity to recognize, again, those strengths of the family, but also these emerging challenges, which in many cases are very complex. And fortunately, there are many new sources of information and data to describe fairly precisely what the underlying problems are and also how to begin to address these needs. One of the major issues is that the Latino population is living very long lives. We know that the US population, because of advances in public health and medical care, are living longer. But what is unique is the Latino population, and particularly the Mexican origin population in the United States, is spending about 2/3 of their life after age 65 with compromised health. And this is also especially for our foreign-born Mexican origin population, based on the data called the Hispanic Established Population for the Epidemiologic Study of the Elderly. And we've been following our older Mexican Americans since 1992 and their caregivers and their families. So we really have a very rich set of data to be able to see how these changes are affecting their ability to care for one another in terms of the resources they need. And so what that means is that this protracted time spent in these longer lives means that caregivers, Latina caregivers, Mexican American caregivers, we're seeing this across most of the subgroups of our Cuban Americans, Puerto Ricans, and our other groups. So they will be spending more of their time, and what comes with that are seriously disabling conditions. The two most common conditions in the Latino population that caregivers are reporting are diabetes type 2 and dementia, Alzheimer's disease. Many times these diseases also, and these conditions co-occur together. And so all of our data, as well as others, those from the AARP, the National Alliance for Caregiving, the National Survey of Caregivers, this is national data also funded by the National Institute on Aging, is showing that this new role is requiring more training, more intensive care, as well as a longer period of time, which will be needed given these longer life expectancies.
You mentioned about the increased longevity rates of the care recipients. Do you see that same increase in the number of caregivers through the different generations?
While the Latino population is relatively young compared to other groups, they are, as I mentioned, rapidly aging. They're aging themselves. The fastest segment of the population is 85 and older. And we're finding that the non-senior populations are children and those from other minority groups are going to comprise the largest segment of our caregiver workforce in years to come. We actually discussed this in a new book co-authored with my colleague, Dr. Fernando Torres Gil, who was the former Assistant Secretary of Aging for the U.S. Department of Health and Human Services, because we wanted to look at the extent to which this sort of racial and ethnic age grading of our labor force will be putting additional strains on the ability for family members to care for one another. We're also finding that in many cases that the young people, their children, other relatives, are needing support themselves. So in many cases, it's mutually beneficial when young members of the family are caring for an aging parent. The average age in our study of our caregivers is about 52 years of age. So other studies are showing a younger age. It depends on what groups you're looking at. Ours, again, is looking at the Mexican origin population.
Okay, so you've touched on a little of that. So let's just stay on that for a minute. What is the impact of the finances of caregivers, the health status of caregivers, employment, and the ability to access needed resources?
Yeah. Well, we've seen since the turn of the century just such tremendous transformations in our families. We are undergoing major changes in the extent to which we can take care of one another, because we are having to go to work and also take care of our parents. And many of these jobs that are Latinos, women, because they're disproportionately the caregivers are employed in, do not come with benefits, healthcare benefits, retirement benefits. Many of them are not represented in areas where it's easy to access resources. Ideally, we'd like to see employers provide more support for the Family Medical Leave Act, for example. That's by law, but other additional supports when a family member is trying to take care of an aging parent. To participate in the FMLA program for its 90 days, and it does require that the caregiver actually pay for those time off. So it's a major hindrance to being able to take advantage of that. So the idea also of many of the millennials who are providing a lot of the support now, again, are benefiting from co-residing with an aging parent. And this is important for them so that they'll be able to get the education that they need. But also, it's a challenge, it's a juggling act in many cases. They're also working. I find with my students, they are multitasking with regard to making ends meet. And this is a public health, kind of almost emerging crisis with regard to dealing with this role strain and stress, because not only are we seeing it sort of for the typical caregiver in the Latino population, but for our young people, our younger generation, and those to come will really have to contend with all of these extra demands with, again, a dynamic economy, and a different way and new arrangements will have to be created.
Right.
And that's where we need the energy focused.
Mm-hmm. In your article, you said that dealing with caregiving support was the first step in fixing the issue or addressing the issue. What does that entail, and what other solutions do you see and recommend?
Our study finds of our 300 Mexican American caregivers that many of them are sort of new to the role and really need information and support for carrying out the role. And again, this role increasingly is not just for custodial care. It's also in many cases, managing diabetes, and many times that's with these are also co-occur with other medically complex problems. So education and outreach is critical for this population in connecting them to services and supports for being able to understand what is in store now, and especially, for example, in dementia caregiving, as the disease progresses, what kind of resources will be needed and how is it possible to be able to prepare for an inevitable decline, which will often comes with additional out-of-pocket expenses. If you look at statistics coming out of the Urban Institute in terms of the cost of caregiving, we're talking, millions and billions of dollars for not just the government, and but also for family caregivers, and that can be very distressing, creating even more strain. So we have caregiver role strain that is, comes about as a result of this burden. But also, again, coping with that, we need culturally appropriate and tailored programs so that, they'll be helpful and not hurtful in being able to deal with this on an ongoing basis. It should be easily accessible. We also need, as I mentioned, arrangements where both generations and multi-generations can get together and help one another. I'm working with my students and colleagues and partners in the city of Austin, just by example, on an intergenerational day program that involves adult daycare and childcare located all in one place. This is a benefit for both generations, and particularly for family caregivers who need these supports. Essential workers, amid this coronavirus pandemic, it's critical that we have these public-private partnerships for our those who need it most, and particularly our Latino population, who again are facing few resources, retirement plans that are being evaporating because of the changing labor force needs. And all of this combined is creating just, again, this extra strain. At the same time, I think we should mention that something that's also emerging in our data and in other studies is this caregiver paradox, that this desire to take care of of their aging parents and is so culturally rooted in the tradition that they're able to sort of buffer off the challenges that they're facing. So even though there's high demands, we're seeing a tremendous amount of resilience. And I think that's a hopeful way to see that, it can happen, but we also need community resilience, and we need the communities and neighborhoods to step up. Our neighbors are a very important source of support, and so often we're unable to turn to them. But for the Latino community, it's these ethnic enclaves can be extremely supportive if the local municipalities can fortify them with the resources they need, such as an intergenerational day center. So that's what we're learning, and I think it's very exciting to see these changes, combining affordable housing with senior services is a whole type of model nationwide that we're seeing. And clearly, this is, again, very relevant for the Latino population because they tend to go reside and form multi-generational households, not only just to make ends meet, but also as they're growing older, what our data show, it's also because they need the long-term care. So it's a very complex relationship we're seeing also at this time, because in many cases our millennials are moving back across all racial and ethnic groups to really try to sort of manage these economic and financial challenges. And so this is a pattern we're going to want to look further at to see how this might be beneficial if, in fact, it's effective. Amid the coronavirus, this is obviously extra problematic because it may be the case where if the space is not available, sheltering at home and wanting to age in place will not be possible.
Yeah. I just want to comment. You've talked a lot about the younger caregiver and the emerging group of younger caregivers. But one of the things that we also see, and I know you've seen it as well, is the older caregiver. And I say that because some years ago, there was a lady who was 80 who called because her mother needed services. And her mother was like 102 or something like that. So when they got to the house, the mother said, "I don't need any services. I'm perfectly fine. It's that daughter of mine that can use services." So we have a lot of older caregivers that are trying to take care of an even older relative. And I'm sure you've seen some of that pattern as well. But go ahead.
Just to add to that, it's because of this life expectancy and this mortality advantage is playing out in terms of our adult children who are providing care. And in many cases, as the data show in many studies, that there's a high percentage with their own health issues that need to be managed.
Well, Dr. Angel, if there's one piece of advice you'd like to leave with our audience, what would that be?
I think expanding upon what we just discussed, I think for all of age groups of our Latino caregivers, it's really to stay healthy and wise and be able to do that in order to be able to provide the care that's needed most, which is likely to be for a long time.
Well, Dr. Angel, thank you so much for joining us today. Your information has been very enlightening, and we hope that you will join us again in the near future.
My pleasure, and thank you, Charlene.